This video is titled Standard Precautions. It was created to furnish you with information about standard precautions and how it works to stop the spread of infection. The video you are watching is an interactive training video. As you're presented with information in this video, questions will be asked to help you understand important points. When a question is asked, quickly select the answer you think is correct. After a 5-second pause, we'll give you the right answer. Make a game of it to see how many questions you can answer correctly. It's fun to learn. Pay attention to the video from this point on, since you never know when a question will be asked. We'll now proceed with the subject matter of this video. What is the purpose of standard precautions? To maintain clean, hygienic, and attractive surroundings without disrupting patients or staff. While doing this, standard precautions is very important. Standard precautions is to be followed by all housekeeping personnel at all times for all patients and rooms, regardless of patient's diagnosis. Standard precautions was adopted because its procedures prevent the needless transfer of bacteria and infectious diseases. These procedures make a hospital a safer place to recover from an illness and a safer place to work. Housekeeping personnel will routinely use appropriate barrier precautions to prevent skin and mucous membrane exposure when possible, when contact with blood or other body fluids from a patient is anticipated. Your supervisor is responsible for monitoring all patient and auxiliary rooms to see that they're properly cleaned according to departmental policy and procedures. Welcome these inspections by your supervisor. Hospital housekeeping is a team effort, and your supervisor may find something you missed. Housekeeping personnel will monitor all trash to see that it is disposed of according to local regulations and federal regulations. It is your job to follow these trash disposal procedures as directed. The housekeeper will clean the patient rooms, hallways, and auxiliary rooms according to your established departmental policy and procedures, and with the categories determined by OSHA, the Occupational Safety and Health Act. Your supervisor will be happy to go over this act and how it impacts your particular duties. Question 1. Standard precaution stands for keeping a barrier between you and a potential for contamination. True or false? If you answered true, you were correct. We'll now discuss personal protective equipment, or PPE. Tasks requiring the use of protective coverings, such as the use of protective gloves, masks, gowns, and goggles, are governed by the following guidelines. You will wear protective gloves when performing the following tasks. When you are cleaning the occupied patient unit, where gross matter of body fluid is present, you should wear protective gloves. You would also wear protective gloves when cleaning bathrooms where gross matter and body fluid is expended. You should wear a gown and protective gloves under the following circumstances. Always wear a gown and protective gloves when wiping up large blood spills. You must also wear a gown and protective gloves when wiping up large quantities of urine or human waste, or when wiping up large quantities of liquid or semi-liquid substances. Question 2. When you are cleaning the occupied patient unit, where gross matter or body fluid is present, you should wear protective gloves. True or false? If you answered true, you were correct. Protective gloves should protect your hands. There are also conditions when you should wear protective gloves and safety glasses. Wear safety glasses and protective gloves when preparing cleaning chemicals. Wear protective gloves when you're handling infectious or chemical waste. Some conditions call for you to wear a mask and safety glasses, as in the following examples. Glasses and a mask are called for whenever you clean the ceiling or anything overhead, or when you're cleaning a vent. To keep you safe, there is another condition when you should wear a mask. But before we reveal this condition, let's see if you can answer the next question. Question 3. When preparing cleaning chemicals, you should wear A. Protective gloves, B. Goggles, C. Mask, D. A and B only. If you answered D, protective gloves and goggles, you were correct. We will now discuss conditions when you should wear protective gloves, a gown, a mask, and safety glasses. Wear a gown, mask, gloves, and goggles when entering and working in an isolation area as indicated by a posted sign on the door, and respect the stop sign alert notice. The sign at the door will explain exactly what you need to wear, so follow its instructions when given. There are housekeeping tasks that initially do not need protective gloves, a gown, a mask, and goggles or glasses. Keep them with you because you may be required to wear some or all of them on a short notice. Therefore, they should be close by. You do not have to wear protective apparel when changing drapes or Venetian blinds, or shampooing a carpet, vacuuming a carpet, mopping a floor, moving furniture, or any other project that does not specifically state wearing protective apparel. Question 4. You should wear which one of these items when shampooing a carpet? A. Protective gloves. B. Mask. C. Glasses. D. None of these. If you answered D, none of these, you were correct. Protective gloves, mask, and glasses do not have to be worn when performing carpet cleaning activities. Here are some precautions to take when handling hospital waste. When handling infectious waste receptacles, always line them with red plastic infectious waste bags. When handling all non-infectious waste receptacles, put in regular trash can liners. Each container for disposal of needles and other sharp objects, also referred to as sharps, will be replaced when filled to the full line. Take the sharps container to the soiled utility room and dispose of it in the proper manner. Remove your protective gloves and thoroughly wash your hands after cleanup of infectious waste. All infectious waste must be separated from non-infectious waste and transported and disposed of separately. All infectious waste containers must have a lid or cover on them. All linen will be considered infectious and handled accordingly by all housekeeping personnel. All soiled linen will be placed in a laundry bag and adequately sealed to contain the linen. When a bag is no more than 2/3 full, it is to be tied securely, closed, and put down a linen chute or brought down in a cart. Hands and other skin surfaces will be washed immediately and thoroughly after the following events happen. Wash hands after accidental unprotected contact with blood and body fluids and other body substances. This is a safe step to follow. Wash before and after cleaning every patient's room. Also wash hands after removal of protective gloves, after eating, using the restroom, coughing or sneezing. Hands are to be washed for 15 seconds with soap, running water, and friction, paying particular attention to around and under fingernails and between the fingers. Question 5. Hands do not have to be washed after you remove impervious gloves. True or false? If you answer false, you are right. Always wash your hands after removing your impervious gloves. These procedures make a hospital a safer place for patients to recover from an illness and provides a healthier place for you to work. We know you will diligently follow the guidelines presented in this video. We will all be better off if you do. Question 6. In isolation areas, housekeepers wear which of the following? A. Protective gloves. B. Gown. C. Mask. D. Goggles. E. All of these. If you answered E, all of these, you were correct. All of these items may be worn in isolation areas, depending upon the type of isolation identified. You have now completed this video on standard precautions. Call your training instructor or housekeeping supervisor. Thank you.